So I wanted to show you all a really cool device that we're using for the dentists out there that follow us, and some cosmetic tip on a device that we use. This is from Bioclear, and this is called a smile design gauge. And if you look at this, I don't know if you can focus in on that. Okay, you'll see the numbers that correspond to the golden proportion rule. So you can just rotate this around and find the width of the central incisor that the patient has, and that'll tell you if you're in line with the proportions of the laterals and the cuspids from what you see from a frontal view. Okay, so for instance, if we look at Diana right now, we're going to take this and we're going to go into her mouth and we're going to see what lines up on her centrals. I'm going to guess that she's actually like an 8.5 width, but no, she's actually more narrow. So then what I'm going to do is I'm going to come around to an 8. I'm going to see what that says. Okay, there she lines up pretty close to ideal. Okay, she's about an 8. And you can see her right lateral is right inside the lines. Her left lateral starts to go outside the line a little bit. So it's a rough gauge of what, and it also will tell you that based on the height of an 8, on the width of an 8, that her central should be 10 millimeter height. So this is just a rough gauge, okay? It's a rough estimate of what you would want to see. It's not like a rule in stone, because let's say I have a patient with a high smile line, then I might want to stick to those parameters a little closer. If I have a patient with a low smile line and she's not showing enough teeth, then I'm going to violate that. She might only be an 8 width, but I might go with 11 or a 12 millimeter length so she can show teeth. Also, you have to keep in mind the thickness of what you're going to build for lip support. So it doesn't take into account anything about how far facial you're going to build the teeth to get good lip volume. But it is a great gauge to use for wax-ups, mock-ups, and right in the patient's mouth as you're carving teeth. Hope that helps you.